A glitch in a new system that Missouri is using now to track COVID cases cranked out some pretty alarming numbers this weekend. On Saturday, the site claimed that Missouri had more than 5,000 positive cases in only 24 hours. And while the real numbers aren't nearly that bad, a local respiratory therapist says now is not the time to let your guard down. KCTV5's Amy Anderson is live now to explain. Amy.
Well, Ellen, Jennifer Smith says if you could actually see what's happening inside any hospital in the metro right now, you'd never leave the house without your mask. She recently took to Facebook to beg her family and friends to stay vigilant.
It's just been a rough week. I've lost a friend last Friday. I've learned other friends are sick.
It is a powerful post, but what Jennifer Smith sees as a respiratory therapist during this pandemic is something most of us can't even comprehend.
When they come to us, basically, they are very sick. They look like a fish out of water. They can't breathe, and they're pleading for help. You know, the last thing they say to us before we intubate them is, please don't let me die. And that is the hardest thing to hear.
Those concerned about the virus are always watching the numbers, but over the weekend in Missouri, watchers may have gotten quite a shock. Cases went from roughly 1,400 to 1,500 per day to more than 5,000 on Saturday alone. Turns out that was likely a glitch in a new system, one they're working to fix by Wednesday of this week. In the meantime, Dr. Randall Williams with the Missouri Department of Health and Senior Services says it's best to look at the bigger picture when it comes to COVID-19 cases.
I would highly recommend, as we've been saying, is look at 7-day averages. Do not follow it day to day with that degree of compulsivity.
In the meantime, Jennifer Smith says COVID patients are sicker and younger than they were in the beginning. She says her hospital is nearly at capacity, and it's weighing heavily on medical workers everywhere.
We've been the ones that have been holding the hands of the dying because we can't let family, and the family is there looking through the window, or we're on FaceTime with the family. Other than that, we are family at that minute to that patient that isn't going to survive.
Now, Smith says she feels like most people continue to see the virus and wearing a mask as a huge inconvenience, and she says she really wishes that would change. Reporting live tonight in Kansas City, Missouri, Amy Anderson, KCTV5 News.
Yeah, no doubt a powerful perspective. Amy, thank you.